The current events bioethical issue I would like to present aligns with my selected topic for my paper, Do Not Resuscitate Orders During Anesthesia. The article title of the current event I have chosen is A Man Collapsed with Do Not Resuscitate tattooed on his chest. Doctors didn't know what to do. The case involved a group of physicians faced with an unusual ethical dilemma when an unconscious 70-year-old man presented to the emergency room with the words Do Not Resuscitate followed by his signature tattooed across his chest. Like so. This left the medical team to be confronted by countless ethical and legal questions, such as was it an accurate representation of what the patient wanted? Was it legally sound? And should they honor it? The unconscious man, who was found to have an elevated blood alcohol level, also had a medical history including COPD, diabetes mellitus, and atrial fibrillation. He had arrived without identification, no family or friends, and no formal documentation of his medical decisions. Initially, the team decided not to honor the tattoo, invoking the principle of not choosing an irreversible path when faced with uncertainty. In an effort to buy more time to make the life or death decision, the man was placed on empirical antibiotics, intravenous fluids, and vasopressors. The medical team then called an ethical consultant who determined the doctors could presume the tattoo was an accurate reflection of the patient's wishes. Several primary bioethical principles are being threatened in this case. The patient's DNR tattoo may be perceived as a reflection of their autonomous decision-making, although there is a question whether the tattoo truly represents the patient's current wishes or if it was influenced by temporary conditions. In regard to informed consent, a patient must be at capacity of understanding before making a medical decision. In this case, the unconscious patient could not provide informed consent. Non-maleficence was violated when the medical team decided to initially not honor the patient's tattoo, as this presented the ethical question of whether resuscitate efforts would be futile or contrary to the patient's best interests, thus causing harm. I found two provisions from the Code of Ethics for Nursing relevant to this event. Provision 3 states, the nurse promotes, advocates for, and protects the rights, health, and safety of the patient. The group of physicians took into careful consideration the patient's tattoo and took the appropriate measures to seek validation of the patient's reflected wishes by consulting an ethics group and asking social work to find next of kin, by which they were later able to track down the man's proper DNR paperwork. Provision 6 states, the nurse, through individual and collective efforts, establishes, maintains, and improves the ethical environment of the work setting and conditions of employment that are conducive to safe, quality healthcare. Through a collaborative effort with the ethics consultants, the medical team was able to move forward with a decision that supported patient-centered care and respect for the patient's best interest. This bioethical issue presents several implications for healthcare. As Dr. Gregory Holt mentioned in the article, this issue calls for a national online registry that can provide quick access to patients' advanced directives and DNR orders so that they can be easily deactivated or reversed. This issue also implicates that healthcare professionals require proper education and training on how to navigate complex ethical dilemmas involving DNR tattoos, including communication skills, conflict resolution, and ethical decision-making frameworks. Healthcare organizations must have clear policies and procedures in place for documenting and communicating patient preferences regarding resuscitation. It is essential that we must approach each case with sensitivity and a commitment to upholding patient autonomy and dignity. Thank you.